Hello friends, myself Dr. Vaishali Sharkar. I am a consultant ENT surgeon practicing in Kolkata. So today I am here to give you a brief idea about oral ulcer. Basically, oral ulcer that we have maybe in the tongue, maybe in the cheeks, maybe in the soft palate, hard palate, okay, even in the oropharynx, okay. If you have ulcer of the oral cavity, okay, it can be due to various reasons, okay. Do not jump in the initial time that oral ulcer is due to cancer. It is one of the differential diagnoses which we always have to keep in mind. But when you are having an oral ulcer, the most important thing that we need to check is the timing of the oral ulcer. Since how long you are facing the ulcer, okay. Now if the ulcer is like of very shorter duration of time, having associated pain, redness, swelling, okay, we think that it is possibly due to some infection or some triggering factor which has caused the ulcer. The triggering factor can be, just I am giving an example, it can be some sort of supari, that is areca nut, it can be some sort of pan, it can be some sort of anything like whatever we used to take it in the mouth, some tobacco chewing, some sort of smoking also, okay. So they may cause it. Those are the triggering factor which may cause oral ulcer, okay. Even a person having diabetes, okay, may have some teeth bite, okay, that may also trigger to a long-standing ulcer. That is sort of oral ulcer, okay. Long-standing, like this long-standing ulcer can be of 1 month, 2 months or so, okay. So we need to exclude what is the cause of oral ulcer and treat accordingly, okay, instead of jumping at the first slot of time that it is a sort of cancer and getting panicked out from the very beginning, okay. Although nevertheless we have to keep in mind it can be the cause. Oral ulcer, when somebody comes to us, we always check it, the ulcer, whether it is red, associated with pain, what is the duration, okay, and we give the possible treatment according to the DDs, okay. Now if that ulcer is not reducing even with the treatment for at least like 14 days or so, then we do biopsy and see what is the cause of the ulcer. But if somebody is coming for a long standing oral ulcer, okay, the hardly there is any pain, or the pain is very deep, boring pain, okay, no such associated cause, or even the person may be associated with diabetes or any other immune deficiency disease also, okay. So we have to keep in mind that it can be a possibility of something deadly like cancer, or is going to be a cancer. So without wasting time, we have to do biopsy and see whether it is benign or malignant, okay. Or benign means it is something which has not gone into cancer, it's just a change in the tissue, is the initial phase, okay. Even there is something more less than the benign thing, that is a pre-cancerous stage, okay. So we have to see whether it is in a pre-cancerous stage, okay, which has not converted. So we have to aggressively treat those cases so that it doesn't convert into cancer. At the same time, avoiding all the triggering factors. Triggering factor can be any sort of addiction like smoking, drinking, tobacco, khoini, pan, even like that areca nuts, that is betel nut. Okay, why I am insisting on betel nut? Betel nut has a thing called aricoline. Okay, is a constituent that causes some triggering factor in the mouth. Even it causes another problem called submucosal fibrosis. So that triggering factors are very important and it should be removed. When you are having ulcer, not to take too much of hot food, too much of spicy food, because the ulcer size will increase. Flare of the ulcer is a sort of triggering factor. Okay, so this thing you have to keep in mind. At the same time, any underlying causes of ulcer needed to be treated. One of the underlying causes is diabetes. Another sort of underlying cause is any sort of autoimmune disease. Okay, that is reducing the body immunity, and so the ulcer that is there is not getting improved. Okay, so those things need to take care. So friends, in nutshell, what I want to say is, if you are having ulcer of the mouth, okay, or the oral cavity, at the initial stage, do not panic. Don't panic. Okay, first see the duration, see what is the ulcer, and if possible, go to the nearest ENT surgeon, get it treated. I want to add one more important thing, very short. Okay, that is, certain ulcers are infective. Okay, and there are many over-the-counter medicine available which are steroid. Okay, which when you apply in the oral ulcer, the ulcer size flare up and it doesn't reduces, and that should be taken care. That over-the-counter medicine preferably avoided. Go to the nearest doctor, treat it urgently as soon as possible. Thank you friends.